we have become an overly medicated society. So if you're struggling with chronic pain, it is really easy to want to just take more and more medication to try and cover up that pain. But there are some very significant dangers of doing that. And we're going to talk about those in this video today. I'm a doctor. I'm an emergency room doctor who treats everything from COVID to gunshot wounds, burns, you name it. I've created this video series to help answer some of your medical questions and the questions that come up every day. If you find this video helpful, please do me a favor and subscribe. The CDC estimates that 20 to 30% of adults in the United States have chronic pain. Now that's a huge number of people. And unfortunately, many of these individuals rely on opioid medications like oxycodone, morphine, hydrocodone, just to name a few, to manage their pain. When treating these patients in the emergency room, I see how dangerous these medications can be when they're retaken in the wrong doses or for the wrong reasons. And taking them chronically has even more serious risks. Opioids were initially developed as painkillers for surgery. They were not intended to be used for chronic pain management. So let us go over some of the problems that you can encounter by taking opioids long-term for chronic pain. One of the most well-known side effects of opioids is constipation. The reason for this is that these medications slow down the movement of your bowel, which leads to less frequent bowel movements and therefore the constipation. This is not usually a problem when taking them for a short time for an acute injury or surgery. However, if you are taking them long-term for chronic pain, this becomes a real issue. So why does this happen? Well, opioids bind to receptors throughout your body, including those in your gut. When they bind to those receptors, they send signals to the parts of your body that control things like bowel movements to slow down. Normally, your bowel has a balance between signals to move things along and signals to relax the bowel and allow it to keep things in. When you add in exogenous or outside opioids into that mix, you upset that balance and cause things to slow down too much. This leads to fewer bowel movements and the inability to have normal stool. It also makes it harder to empty your bowels completely, because the muscles in your gut that are responsible for pushing things out don't get the signal to contract or squeeze as they normally would. Now, in addition to having the signal to push things along and relax, you also have normal flora. Your bacteria in your gut that are responsible for breaking down stool and allowing it to pass easily through your system. Taking opioids long-term can actually kill off this good bacteria, making things even worse. You may have heard of something called opioid-induced hyperalgesia. This is a condition where taking opioids actually causes you to have more pain. It sounds crazy, but it's true. It occurs in anywhere from 10 to 60% of patients who take opioids long-term. There are several theories as to why this happens, but the general consensus seems to be that when you take opioids long-term, you build up a tolerance to them. So you need more and more of them to get the same effect. Your body then starts to compensate for this higher dose of opioids by producing more pain receptors and sensitizing the nerves that carry pain signals to the brain. This means that the pain signals get stronger and more painful. In addition, your body produces less natural pain-relieving chemicals, making this cycle even worse. If you think about it, this kind of makes sense. Opioids blunt or dampen the sensation of pain. So if you take them long-term and your body gets used to them, it will try and compensate by amplifying its own pain response. Another big problem with taking opioids long-term is the risk of addiction. Addiction is a disease characterized by compulsive engagement in rewarding stimuli, despite adverse consequences. And while not everyone who takes opioids long-term will develop an addiction, it is still a very real possibility. In fact, the American Academy of Pain Medicine states that the potential for addiction is present with all opioid agonist medications, meaning medications that mimic the effects of opioids. And this is true whether you take them by mouth, injection, or any other route of administration. There are several factors that increase the likelihood of developing an opioid use disorder, including having a personal history of substance abuse, having a family history of substance abuse, mental health disorders such as depression, anxiety, or PTSD, and being prescribed a high dose of opioids. It's important to note here that physical dependence is different from addiction. Physical dependence is when your body adapts to the presence of a drug and then suffers withdrawal symptoms when the drug is stopped. Addiction, on the other hand, is a psychological and behavioral disorder. Common withdrawal symptoms include nausea, vomiting, diarrhea, abdominal pain, tremors or shaking, insomnia, anxiety, sweating, and more. These can be pretty miserable, and some of them can even be dangerous.
Yes.
For example, seizures can occur when stopping certain opioids. Because of this, it's not recommended to stop taking opioids suddenly. Instead, you should taper off them slowly under the guidance of your doctor. Another serious risk of taking opioids long-term is the risk of overdose. As mentioned earlier, when taking opioids long-term, you may need to take higher doses to get the same effect or pain relief. This increases the likelihood of an overdose because you may accidentally take too much. In fact, a study published in the Journal of the American Medical Association found that taking long-term opioid therapy for chronic pain increases the risk of a drug overdose 5-fold. So what does this mean exactly? What is an overdose? Well, an overdose occurs when you take more of a medication than your body can handle. In the case of opioids, this can lead to slowed breathing, low blood pressure, small pupils, and in severe cases, it can even lead to death. In addition to the risks associated with taking too much opioids, you also have to worry about taking too little. If you take less than your body is used to, you may experience withdrawal symptoms as previously discussed. You may also not get adequate pain relief, which can impact your quality of life and ability to function. Finally, there are other risks associated with taking opioids long-term. These include a higher risk of falls, cognitive impairment, or issues with memory and thinking, an increased risk of dying prematurely. As you can see, there are many risks associated with taking opioids long-term. While they can be effective for short-term pain relief, it's important to weigh the risks and benefits before starting them for chronic pain. So what can you do instead? There are a number of non-pharmacological or non-medication options that can help you manage chronic pain effectively without the risks associated with opioids. These include physical therapy, occupational therapy, acupuncture, massage, yoga, meditation, and more. In addition, there are also alternative medications that can help with chronic pain, such as antidepressants and anticonvulsants. So before you reach for that extra Percocet or oxycodone, consider the risks and benefits and talk to your doctor about alternative options. There is no shame in being on chronic pain medication, and there is absolutely nothing wrong with you if you need to take them. My goal with this video is not to shame anyone who is taking opioids long-term, but to raise awareness about the risks so that people can make informed decisions about their pain management. Pain is a complex, highly individual experience, and there is no one-size-fits-all approach to management. We have to work closely with our doctors to find what works best for us. Thanks so much for watching. Please make sure you subscribe and turn your notifications on. When you do that and you hit that like button, you let the platform know that you'd like to see more videos like this one. Thank you so much for watching, and stay healthy, my friends.